Rachel, similar story probably, but a little different in the fact that you're a private entity. But can you talk about American Eagle and what metrics you look at as you evaluate the program moving forward?
Well, like I said, we started really focusing on workers' compensation. That was the area that we were trying to target and make some gains for. And again, like I said, it didn't happen overnight. It actually happened over a period of years. We started with our job analysis first. And then the second thing that we implemented was on-site physical therapy. Because of our location in Ottawa, Kansas, we have associates who, you would think that we're all driving around in the city and it's just fine, but they are not used to driving in the city. They're not interested in driving in the city, and asking them to go 25 minutes for care was a big impact to them. So bringing that on-site physical therapy was just a really huge win. Our associates have relationships with the therapists that are there on site. They're seeing the same person continuously, and they're only having to walk off the floor to get that care. It's made a very huge impact. As well as that we set out to really improve and make relationships with our occupational medicine clinics. We gained those relationships, we made those relationships, and we worked to continue to grow so that everybody understood what we were trying to accomplish and continue that accomplishment. We have since implemented the post office offer physical testing, and that's gone really well for us. More importantly, it's actually gotten the word out within our community and those kind of things that it takes this kind of work to do our job. And if you're not capable of doing it, you might think about whether this is really for you, because yes, you do have to lift 50-pound boxes repetitively, and it's not just putting a pair of jeans in a box all day long. It can be more than that. We have, made excellent strides. We, from 2010 to 2011, we reduced, our number of OSHA recordables by close to 50%. And right now, based on where we're at trending with 2012 to 2010, it's going to be an 80% improvement. And literally, it was just us taking and making it the focus. And, like I said, nothing happened overnight. We did little by little by little. And, and we're setting in a really good place where, it's not even something where it used to be something we talked about constantly. It's not even something that we're talking about routinely, which is freeing us up to have more conversations about wellness and smoking cessation and other things that could just really benefit our population, which I didn't mention that earlier. We employ 650 people at the distribution center in Ottawa.
So now you're on point. So does anybody have any questions for these groups that you want to ask? Now's your chance. Before you answer, Cheryl asked what Rachel attributes the significant injury rates to. Right? Is that right, Cheryl? I just want to make sure everybody can hear it.
It's honestly been a piece of everything. I don't know that there's one piece of that pie that has been any more meaningful than the other, but it's been the partnership. The people from ARC to, at one time, Dr. Hamedi was our occupational physician. Everybody understood what our mission was. Our claim handlers did, our case managers did, the nurse managers. Everybody was on board to get us to the place that we needed to be. And through that continued improvement, and as we're making strides in every area, things are just continued to put in place. And again, I think it's just that we didn't get defeated in 2009 when it wasn't a big improvement. We didn't get defeated in 2010 when it wasn't it was less of an improvement. We continued to implement things that we believed were going to have an impact, and here we are, 4 or so years later, really seeing the benefits of that. And it's taken a concentrated group of people, within our organization and with our partnerships to make that happen. But more importantly, I think that the number one thing that I personally like about this and the strides that we've made is that our associate satisfaction of the care that they are receiving is through the roof. We did surveys back then of how do you think your experience went with workers' compensation, your doctor, your claim manager, those kind of things. And the amount of positive feedback that we receive now about all the people involved in this process is just through the roof. And I would, as obviously claims are going down, the number of claims that are litigated are going down. All sorts of things are just going down for us, and I think that it's been a culture shift for our company of just really putting the focus on it and making it important.
Go ahead.
I wanted to ask Betty, can you tell me what the startup cost of the on-site clinic was, the hours, and if you measured what the cost of it versus the savings on the health insurance side?
So the question was what the startup costs were what measurements you're looking at for cost versus value, and there was one other piece in there that I didn't get.
The hours, and if you have a doctor on
The hours. Yeah, the hours of accessibility or operation for the clinic.
Okay. Our on-site clinic is actually on lease space just adjacent to our campus, and we purposely did that. We looked at a lot of sites on our campus where we would not have had rent, we would have had the building and so forth. But we were very concerned about one issue that kept coming up from our associates, and that was confidentiality. Over and over, we heard that as the only concern that associates had. They didn't want to feel like their manager was seeing them go to the clinic, or that they had the privacy to go when they needed to go. So we were very fortunate. We were able to locate a facility that's literally on the boundary line of our property, of our campus, that happened to have been a previous doctor's clinic. So there was some remodeling that was needed, but not a great deal. When we looked at the startup costs, then we had to include the rent and various equipment to provide. The facility is staffed by a nurse practitioner, an LPN, and a PT. It is open 5 days a week, Monday through Friday, roughly 35 hours during that week, and we are probably going to, in the future, need to expand that, but at this time we feel we are sufficient in terms of the 35 hours. In terms of the startup cost, actually I need to think in terms of that. I could tell you the annual cost, but the annual cost include 3 different items. Again, we didn't look at just the clinic for health care. We looked at it, we'd been spending money at occupational health clinics for workers' comp, as well as for our post-op or essential testing and our drug screens. And we combine all of that into the program. So it's more than just a clinic for health care, personal health care. Our operation of that on an annual basis runs us right around $450,000.
and the cost, how much is it saving on your health insurance plan side?
Well, we've had just the one full year, but we've seen savings in specific areas as it relates to specialist visits, ER visits, utilization in terms of the pharmacy, because they draw lab work there. And we're seeing probably in this first year probably about a 25 to 30% reduction in terms of our health plan cost. We anticipate over time that will go up.
Yep.
Betty, can you share a little bit more about your outcomes-based wellness program that you're moving towards?
And so the question was for Betty to share more about our outcomes-based wellness programs.
Our program, as I mentioned, over the years has been really activity-focused. We used to do a lot of tracking of exercise hours and that type of thing. We did do a smoking discount or non-smoking discount, but it was more activity-based. What we're doing now is really phasing in an outcome-based expectation of our associates. They are required to have a health risk assessment and biometrics, and then as a result of their findings, they would be classified into one of 3 categories: no risk, medium risk, or high risk. And based on their risk level, they would have expectations to see dietitians, sport fitness counselors, nurses, etc. And that is a requirement for them to get a discount on their health insurance. Then separate from that, we do have some activity related to education as well as physical fitness that they can earn dollars to go into their health fund. I think I mentioned we went self-insured. We're in a high deductible health plan with a health fund that they can gain on a quarterly basis dollars for. What we're looking at for our plan year this next year is starting to require some additional factors. They will be required to have a physical or a preventive care exam and follow whatever is required for their age group. And in 2014, we will be going to a program where they will be expected to be within their limits in terms of, for example, weight, whatever their limits are for their age and their group, that would be the expectation. So we're moving towards that gradually.
I think it kind of fits with, again, this is maybe a little bit self-serving because a lot of this leads back to ARC, but I don't mean it that way. If you could talk a little bit about, for each of you, because so much of today was talking about choosing providers, if you guys could talk about what you're doing with regard to your provider relationships and how you're choosing them and how you're determining where you direct care to. So we'll just go down the line, Betty. I don't know if you want to, I mean, I guess you're unique in that you have all of that, for the most part, directed in-house, but if you want to comment on it, that'd be great.
Well, in terms of the clinic and the lab and the PT services that we provide, what we find in the marketplace is there are a variety of providers out there, but what's most important to us is that we establish a partnership and a long-term commitment to each other. We see those individuals as being key partners in our productivity management and our health management for our workforce. So when we're looking at providers, we're not only looking at cost and services, but we're looking at their mission and their values as an organization.
Eric?
I have to say very similar to Betty's. We're, again, self-administered, self-insured, self-administered, and we've got a number of adjusters that have been with us for a long time and have developed relationships with providers out there and have a comfort level with them. But again, we're looking at the same type of things that Betty is in terms of their values and always looking at outcomes and always trying to measure outcomes and make sure that we're getting the best care for the best number of dollars.
Kelly?
With a state agency, it runs a little different. We actually, our work comp's controlled by another agency, so our agency really doesn't control what providers we go see. It's directed by Kansas Department of Health and Environment now. It replaced another department. They shut one department down and combined it with another one. So really for us, when you see our reduction in dollar costs, that really doesn't affect us as an agency. It affects the general fund. We still get billed the same. We've always paid the same amount into the general fund for health care and for work comp. So, but that's to pay that agency to manage it for us. But they have a list of providers, and pretty much they tell us where our people go, and we've been fighting that. But we did have to go through them for pre-employment physicals to get the okay to even put a contract together to even do it, and they did allow us to do that. So,
Rachel?
Within the last couple of years, we have changed occupational medicine clinics. So, we did a very thorough reference evaluation. We went in, we saw the clinics, we talked to references. We were even able, in some respects, to anonymously talk to patients that had received positive care. Our insurance agency weighed in. We asked ARC for their opinion. We asked anybody who, had an opinion and a stake in the game to give us their feedback, because in the end, everybody in our circle has to be a partner with one another. And that's really been the biggest thing is that, and one of the things that I can say about our relationship with ARC is that none of the individuals with ARC has ever told us no on anything. They literally have said yes, and here's a better idea, or yes, and here's a different idea. They are continually wanting us to succeed, and it's been a really positive experience, and it's been even more positive to have them on site. I can only envision, having the clinic, how that would be such a positive benefit. But having somebody that you can go to, even in my situation, I had an ergonomic issue at my desk when I switched offices, and all of a sudden, here's my friend from ARC telling me that I have the wrong chair. It's just really nice to know that somebody's there and available when you have something really small or something really big.
I appreciate that commercial, by the way, Rachel.
And I'm not getting paid.
Yeah. Likewise, though, and I can speak for all medical providers with all these groups, Rachel talked about the satisfaction for her associates. I can tell you, not just us, our competitors, the satisfaction for medical providers when they work with employers that take control. And when they say, this isn't a heavy job, or very heavy, they give you very specific essential functions that you can start to tailor your return to work programs around. It's not ambiguous. It's not, it is clear and it's concise. And so what's great is because the employers in each of these cases have mandated transparency, and they've mandated cooperation and coordination among what would otherwise be disparate providers. And they've gone above it and said, here's the focus. Joe's job is to carry a 50-pound tire to a 48-inch height and lift it to a shelf and do et cetera, et cetera, et cetera. So all of us, whether we have the same pay or not, we're working around the same focus. It is such a better environment for the providers to work in because there's clarity on it. And so I think that that reflects back probably in your patient satisfaction, that your providers are more satisfied in providing care for you because we have clarity. And we're held accountable to that clarity instead of ambiguity and frustration. So I think it's great, and that's where it's successful for everybody. Any other questions for our panel? I think they're going to be around. There's two things, and we're going to do a giveaway. What I want to make sure everybody knew is sometimes it's difficult in all of these rooms, you don't know. Those PowerPoint presentations for everybody are going to be available online. That's correct. Am I saying that right? Online. So at arcpt.com. Everybody's nodding to me, so I think I must be right in what I'm saying. But if you want them, if you want to look at them, and I believe on everybody's PowerPoint also is contact information to talk. Certainly our panel is going to be around. They didn't have PowerPoint presentations, but I'm sure, and I'm speaking for them ahead of time, that they'd be okay if you contacted us. If you wanted to contact them individually offline to discuss something, depending on their availability, they would probably love to have a phone conversation with you about something specific if you didn't feel comfortable asking it in this big environment. But what I'm going to do now is we are giving away two $50 gift cards. You did not have to put like a business card. Your presence here nominated you to be in this bowl. So we're going to pull them now and give two $50 Visa gift cards. Have to be present to win, so if you're not, sorry. And our first winner is Terry Hook Shannon from CBiz. She just took off, I think she just took off with, she lost, sorry. Next, we have Sharon Peterson. Sharon! Yeah. Here, I'll pull the other one. We'll get it to you, Sharon, I promise. You can stay there. The next one is Vian Tompkins. Hey! So, to Betty, Eric, Kelly, and Rachel, let's give them a hand for time. For our speakers earlier, and really for you guys, again, for coming here today, taking your valuable time, hopefully to learn and to be inspired to do something meaningful in your space tomorrow. I want to give you guys a round of applause. Thank you for being with us today. And just because it helps me, one last round of applause for Leslie, Pam, Mary, everybody who put this whole thing on, and Brian. We're early. We're adjourned. Thanks, you guys.